Yeah, so I mean, in the early stage of a groin strain, again, you're looking at the how they injure it. Generally, with a groin strain, it's going to be kicking a ball, or it's going to be the foot slipping in the turf, or something like that, and then they're trying to push off. So again, you look at the mechanism first. Then going into the treatment side of things, you've got to get the ice and compression on. You've got to get the usual stages of price. Now it's a little bit harder for a groin because of the position that it's in. So we would still use an ice and compression machine, but I have to say I don't think it's quite as effective as probably for some of the other muscles. So we probably would supplement that with just using ice as well. The other thing you can do is go into an ice bath. Which is, okay, you don't get the ice compression side of things, but you will make sure that you are getting the cold into it initially. So that in early stages is really important. You can wear compression shorts, you can use a compression bandage, anything in those first early stages to get into the inflammation stage and then out of that inflammation stage as quick as you can, because that's what you want. Everybody thinks inflammation's a bad thing, but actually inflammation is vital. Absolutely vital for the healing process. So what you want to do is get into it, get it to peak as fast as you can, and then as fast as you can get out the other side so you can start to get into the proliferation stages of healing, and etc. So that would be the first things I would do. First couple of days, I just, we just do tons and tons of ice. Just every hour, 20 minutes, every hour, 20 minutes. Just keep going, keep going, keep going, keep going. Because what you're trying to do, as I said, is get the whole thing to calm down initially. So that would be my first stages with a groin strain. Then I start to think about bringing in some of the electrotherapy. So I'd do some ultrasound. Again, we might even do some pulse shortwave, maybe do some laser. And that, again, would take it up until about the first week. And then I would start to tailor that off a little bit, in my opinion. And then you're starting to use hot and cold, because what you want to try and do is flush out all the byproducts and all the waste products. So we want to try and get that out of the way, so we do that. And then you're thinking about massage, so you've got to start to think about how you're going to, again, early on I wouldn't massage it because they are very, very, very tender, especially groin muscles, because the area you're dealing with, they are very, very, very tender. So again, with I was doing anything in the first few days, it would just be a very light flush, as we call it, in terms of just getting rid of anything in the surface, because you potentially will still get a bruise, so you might want to flush some of that out of the way. And then as the time goes on, you then get deeper and deeper and deeper, but I wouldn't start the massage for probably 4 or 5 days.